Welcome to Forum 360, a global outlook with a local view. We're a nonprofit organization funded with grants and donations. To find out more about us, go to forum360.org, where you can also find our programs. I'm your host, Pat Simons. The COVID-19 pandemic has fully exposed health inequity in our society. We see it in the disproportion that contribute to inequity and what remedies are needed. I'd like to start off with some basic definitions to set the table. Health is a state of complete physical, mental. Health equity is a matter of social justice and ethical fairness in assuring access and opportunities for wellness and health. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced in predominantly disadvantaged populations. Disparities are our metric that we use to measure progress toward achieving health equity. Joining me is Elizabeth Foster, Master's in Public Health, who serves as the Epidemiology and Data Surveillance Supervisor for the Summit County Health Department, and Karen Leith, PhD, who serves as a director on the League of Women Voters Ohio Board. They have recently released a position on health equity. I would like to welcome you both to the program. We have a lot to discuss, so we're going to dive right in. Elizabeth, I have a question for you right off the bat. Can you tell our audience, what does your position at the health department entail?
Certainly. Thanks, Pat, for having me today. I am the supervisor of our epidemiology staff, which is really exciting. So essentially, I oversee their work, and part of that role is taking that work and finding ways to distill it and to get it out into the community. So whether we dashboards, community reports, policy briefs, things of that nature, really just taking that data and making it digestible for the public in a variety of different sectors.
So that can evolve into programs and goals for the health department, is the way I understand it?
Absolutely. So that data is useful to our community partners and our community members, but it's also useful internally here at the health district. So we have a staff of approximately 150 to 200, and we use that data to help drive our programming internally. So we use it to know what our community issues are, what disparities there might be that exist, and it really helps use that data to inform our decision-making process.
Well, since we are talking about health equity and the disparities that influence it, can you give us an idea of some of the disparities that contribute to inequity, and how do you measure their impact?
Certainly. So some of the factors that contribute to health inequities are things that we usually kind of wrap up in a bucket called the social determinants of health. So a lot of these things are income, education, socioeconomic status, and what that can do is contribute to a variety of outcomes in terms of housing conditions, the quality of job you might have, how much money you make, your access to health insurance, things of that nature. And those then in turn affect health outcomes. So things like life expectancy, birth outcomes, what you're more likely to die from, what diseases you may get. So it all kind of works together to create an overall picture of health.
Well, thank you. What populations would generally be most affected by disparities?
So essentially, most of the time, health disparities affect our populations that live in poverty, have lower economic status. We see disparities between gender. We've discussed the wage gap before, so we know that exists. There are disparities based on age, and then the most prominent that we have that I think has come to the attention of a lot of the general public lately is that of race. And this is something that has existed for a very long time, and I think our population has gotten a lot more comfortable talking about race in this regard. So it's definitely something that we have seen in the data and in the literature for a while now, but race is definitely one of those things that you see across the board, whether it's disease outcomes, life expectancy, birth outcomes, infant mortality rates, things of that nature. And we essentially saw it come to light during the COVID pandemic. I think that's kind of that brought it all to the forefront.
Your job sounds like you are the nerve center for public health in Summit County.
I don't know if I would go that far, but thank you. I appreciate it.
Karen Leith is from the League of Women Voters Ohio Board. It is a politically active but nonpartisan organization, and they advocate and educate and lobby on issues. Now, League just recently adopted a new position on health equity. And Karen, I was kind of curious, did you find similarities from your research as what Elizabeth is talking about in terms of disparities and their impact?
Oh, definitely. Everything she mentioned is actually touched upon in the health equity study and research that was done. What was important about League is it was because a group from League members noticed the disparities that they brought to convention, the need for this study for League to have a position. We are the first state league in the country to issue a position on health equity. The original study committee was made up of health professionals, including people from health departments. In my employment before I retired, I actually worked with some of the communities and worked within Summit County. So at times even worked with the Summit County Health Department in terms of reaching out to the community. And those are important partnerships that League has always looked at. So the fact that from the bottom up, members of League were noticing discrepancies in health, and that these disparities had a lot to do with all of the factors Liz just talked about, the races, the neighborhoods, the housing, etc. League cannot act unless we have a position. So therefore the need to form this study and actually look at a broader stance than just Summit County in terms of those disparities. So lots of similarities and ways of therefore working together.
So Karen, based on the new equity position of League, can you just give us an outline of what is the main point of that position and an example of how it might be used?
Good question, Pat. Thank you. Basically, it is the first time that League has actually looked at structural racism as an underlying cause and how that therefore relates to poverty and the living in unhealthy neighborhoods. And that's a really key point, unhealthy neighborhoods. So the question was, what makes a healthy neighborhood? That's where where we can be doing a lot of education, where we can pair with health departments to reach out to communities and nonprofits and look at how we build from the bottom up in bringing healthier aspects of neighborhoods to those places that are food deserts or brown spaces, just a whole list of things.
Well, what I saw in the position, I thought that was fairly brilliant, is that you have a lot of ability to pivot, especially when lobbying comes up. There can be things in the budget, the state budget, that you could use this position, and differing things that this position can be used in. I thought it was very well done. I think because you are League, and you have such a strong identity as a proponent of voters' rights, and we encourage engaged activist citizenry, do you think health inequity has any impact on civic involvement?
Yes, it does. First of all, if you're living in a poorer neighborhood, you're so concentrated on just surviving that you're not as engaged. And that's where community partners and the ability of members of leagues have an incredible role. One of the most important aspects of this position is the number one recommendation that was made, that we legislate that all policy coming out of all areas of government be evaluated in terms of their impact on health, so that this is a position that can look at how transportation is taken care of how we develop communities, how we basically distribute money and build infrastructure that helps an unhealthy neighborhood become a healthy neighborhood.
So you could actually influencing a strong democracy.
Yes,
by
definitely. And it takes people at all levels to do that. It takes people who can mentor in terms of what civic engagement means and the best skills. It takes being in partnership with health departments to know what the main focus of an area is in terms of the worst disparities. It takes education of a whole community, because the only way we're going to solve health inequities is to bring whole communities together and governments at all levels together.
What's encouraging is I'm hearing perhaps collaboration and alliance to help health departments and other agencies that have to promote this. If you've just tuned in, this is Forum 360, and Elizabeth Foster, Summit County Health Department, and Karen Leith, League of Women Voters Ohio, are discussing health equity. Elizabeth, I want to turn toward Summit County declared racism a health crisis in June of 2020. They were supposed to be releasing an action plan by December 31st. I don't know that status. But I guess what my question is, and you may have answered this to some degree, how does the health department do you have a view on how racism affects health equity? And will you have a role in Summit County's plan?
Absolutely. And I think one of the things that Karen mentioned previously was that you're really seeing people call racism out now. It was one of those things that we didn't really say a lot in our circles and in our rooms. We would talk about the social determinants of health. We would talk about health disparities, but now we're actually saying the word structural racism, institutional racism, and I think the declaration that the county made is a testament to that. That we're really ready to call this what it is, and to start putting action behind it. I think Karen also noted the importance of partnerships, and that's going to be our role here as the health department. We work with a variety of partners: nonprofit, hospitals, schools, public safety, and COVID. One of the silver linings, I think, of COVID is it's really strengthened a lot of those partnerships, because we recognize that none of us can do this on our own. And I think as it relates to race and racism, the health department will be there to help monitor outcomes, to continue to look at the data, and to really help paint that picture for our policymakers and our community who want to tackle this issue.
I'm really glad that you found a silver lining in COVID. Thank you for that. Well, speaking of COVID, let's talk about the COVID pandemic to some extent. Speaking of your silver lining, now from your research, are you able to actually quantify and identify how the pandemic has revealed and really put a spotlight on health inequity, and what its impact is on vulnerable populations? Would you like to speak a little bit more about that specifically?
Absolutely. So at this point, because COVID is so widespread, we have really seen those disparities even out. But the early stages of the pandemic, we really saw a highlighting on the racial disparity. We saw that where the percent of population might be 15% of our population, but they were making up 30% of the COVID cases. So we really recognize that, and that's for a variety of reasons. A lot of individuals in frontline jobs, whether it be food service or staff at the hospital that cleans rooms or delivers meals or transportation, those were the jobs where individuals necessarily weren't able to stay home and work from home. They had to continue to go to work, although there was the threat of this virus. So we really saw that economic disparity as well. So individuals who were in those lower paying wage jobs were essentially the ones that were getting sick. And I think that again, it's a silver lining because it brought it all to the forefront. And then you pair that with some of the other things that were going on in our society at that time with George Floyd and Breonna Taylor and some of those national movements. And I think a lot of people just kind of started talking about this openly, maybe for the first time.
Well, that's encouraging, and thank you for that explanation. Currently, there are at least 2 vaccines and more emerging. What should the public know about its safety and effectiveness, and when and how might they receive it?
Okay, certainly. So we definitely know that the vaccine approval process and testing and research, it moved very quick, which I think has given some people cause for concern. But it's really just a big feat of our scientific community to be able to push these vaccines as quickly as they have. Right now, we are in phase 1A, which is our first responders, our EMS, healthcare providers, and long-term care facilities, and a few other groups that kind of meet that criteria. I think my message to the public would be just to be patient. The fact that we have such a limited supply and we're really trying to push out this vaccine to those who need it the most first. We are vaccinating pretty much every day. The hospitals have also received an allocation of vaccine. Some of the pharmacies are taking care of long-term care. So I think it's just going to be one of those things where once it's open for the general public, we will highly publicize it. We will make it available to individuals. But just kind of bear with us as we truck along through getting these other groups and phases vaccinated.
Well, you also have a COVID-19 dashboard on your website, and that can be accessed at www.scph.org/COVID. What are on those pages, and is that someplace where people can monitor the vaccine distribution?
So we don't have vaccine distribution on there yet. We do on our general website. The dashboard, however, is where individuals can kind of play around with the COVID cases. They can look at it by zip code. They can look at it by race, by gender, by age. You can see how many cases are coming in per day. So you can really track the trends. So it really does put that information in the hands of the general population so that they can keep an eye on where we are as a community.
So if I get the 2 shots of the vaccine, can I stop wearing my mask?
No, not yet. It's not recommended to stop wearing a mask until we actually have that herd immunity, which is going to be about 75% of the general public. The mask is still one of the, it's not the only strategy, but it, along with social distancing, washing our hands, things of that nature, it is one of our best strategies at reducing disease spread.
Thank you. Karen, you talked about this a little bit. Because of this health equity position, how does League collaborate and decide to work with other organizations to advocate and educate?
A lot of it has to do with priorities of focus. And, while we're mainly a voting rights organization, and this year we'll be working on redistricting, we do have a lot of social justice positions. And the League members decide on the priorities. We also work very hard with basically coming to terms with what's important in each area of League. We have 33 leagues across the state. And basically with this health equity position, we're going to be doing a lot more education. It's going to be one of our priorities this year. In fact, I'd like to do a shout out for Real Talk in Northeast Ohio, which will be taking up the health equity position with the whole idea of educating in how people can become engaged. And the starting point is the local health department, because that's where you find where the necessary focus is in the disparities. And therefore it is very localized. And we have all of these local health departments. And if you talk to every health department, you will see a slightly different and sometimes a great difference in focus, depending on where they're located. The fact that in Summit County, we have racism as a health crisis, and the fact that the health department is picking up on that means it's a perfect starting point for leagues in Summit County to look at that, and which is why it is going to be one of the programs for Real Talk in Northeast Ohio.
How do they access Real Talk?
We actually are putting up a website, and in the next couple of weeks, we will have Real Talk LWV. Right now it's .com. It is in the final stages of being developed. Basically, local leagues will be advertising as much as possible to the public about Real Talk. The first topic in February will be education, but the next topic is health disparities. And we're looking at March and April for health disparities. And part of it is therefore even teaching people that the health department is the greatest source of knowing where the issues are.
Well, Karen Leith, meet Elizabeth Foster. Because I think that it sounds like leagues can use models of progression, collaboration that they're finding. So it has a large impact across the state if we coordinate that effort. Well, I can't believe it, but we have run out of time. So I want to thank Elizabeth Foster, Epidemiology and Data Surveillance Supervisor from the Summit County Health Department, and Karen Leith from League of Women Voters Ohio. Thank you for opening up a compelling dialogue on health equity. Identifying health disparities and their effect, whether they are intentionally or unintentionally created, is a first step in attaining health equity. This is Pat Simons for Forum 360. Thanks for tuning in. Have a great day.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.